Good morning, Mr. Roosevelt. My name is Vanessa, and I'm going to be your student nurse today. We're going to go ahead and perform some suctioning and do some trach care. Can you start by just nodding your head if this is, in fact, your correct full name, Theodore Roosevelt? Okay, great. And your date of birth is April 7th, 1977? Okay, and do you have any allergies? No, terrific. All right, Mr. Roosevelt. I'm just going to start by assessing your respiratory status. Your bed's high enough and your brakes are on. So I'm going to go ahead and apply this pulse oximeter to your finger to just check your oxygenation levels. And I'm just going to listen to you breathe, okay? Just take a couple deep breaths for me. Okay, and I'm just going to have you turn over onto your side. Great. Now just a couple more deep breaths. Okay, so it sounds like you got some fluid in there. We're just going to try to get some of it out, okay? We would hyperoxygenate you, but your oxygen levels are good. So I'm going to go ahead and open up my suction kit here. I would turn my machine on first, open my kit. Go ahead and fill this with water. Okay. Hygiene. Now I will use my left hand to plug this into my machine, and I'm going to go ahead and just test to make sure it's suctioning. Yep, that sounds good. Okay, so I'm just going to go ahead and insert this in your trach, and I want you to try to cough for me, okay? Here we go. Intermittent suctioning. Okay, now we clean my tube out. And I would suction again if I needed to, but I think we got everything we needed. Okay, so go ahead and get that out of there. Okay, I'm going to get rid of all this in the trash. And I'm going to go ahead and assess your respiratory status again, okay? So your pulse oxygen looks good. That's up to 97. That's awesome. And I'm just going to listen to you breathe one more time, okay, Mr. Roosevelt? All right, just a couple deep breaths. Okay, and one more time, I'm just going to have you roll onto your side. Deep breath. All right, everything sounds a lot better. So I'm just going to go ahead and put on another pair of gloves, and then I'm going to assess the stoma site and get that old dressing off of there, okay? All right, I'm just going to remove this dressing. Okay, and I'm just looking for redness and irritation, and everything looks good. Some drainage. All right. Now I'm going to go ahead and open my tracheostomy care kit. Move this out of the way. Let's get that over there. there. Fill this up with some more sterile water. Okay, and I'm going to use these sterile gloves. Okay. Just make sure I have all my stuff organized here. I don't need these. Alright, now I'm just going to remove the internal cannula and just place it right in here. Go ahead and just clean that. Make sure I don't put my arm over my sterile field. Rinse. Tap that out here in the clean water. And then insert that inner cannula. Then I'm going to use this and my sterile water to clean from the inside out. Alright, now that everything looks clean, I'm going to go ahead and pat that dry so we don't end up with any irritation. Okay. And I'm going to go ahead and apply a new dressing. Wonderful. And I would change out the straps, but everything looks clean. So we'll probably do that the next time we change your dressing, Mr. Roosevelt. Would you like me to perform mouth care, or do you want any chapstick? No? Okay, you're feeling good? All right, in that case, I'm just going to clean up my mess here, and I'll get out of your hair. At this point, I would document any irregularities that I saw, how much fluid I was able to suction, how well the patient tolerated the procedure. Get rid of all of this stuff. I would lower Mr. Roosevelt's bed. I would make sure that he had the call light and anything else that he may need within his reach. And I would thank him and have a nice day. Hopefully that was everything I needed.